seems to me reasonable that we should do some alternative to the wash stations. You know, hand sanitizer and those hand wipes is nothing requiring much creativity. They may have to take them home overnight so they don't freeze, and have some kind of little thing you know, screw it on, you know, have some kind of holder for it. But I don't like the idea at all about no way to sanitize your hands around the porta potty. That even if we have 600 people a day instead of, you know, 1,000 people a day, that's not right. So have you looked at any alternatives to the hand wash, the wash stations?
Yep, great question too. The bathrooms have the alcohol pumps in them that we never took those out. So they come with that. We have those at Hiawatha and at the incline. Those will stay there and alcohol doesn't freeze, so they don't freeze. So we don't have a problem with that. We have a bigger problem if they get stolen or something, but they replace them and we haven't had too many problems with that. And then, you know, I will check, you know, great idea. Maybe they have one of those big pumps at the table so people can actually sanitize there. I think it's a great idea, and I'll talk to Kurt Schroeder and the incline group about that. And that's not expensive, and it could, you know, encourage people to pump as well when they're back down or going up the incline.
Yeah, or even if they have those little, you know, disposable tissues on the table, and their own attendants might want to use those too.
Yep.
Anyway.
Yeah, I'll pass that on. It's a great idea. And but we never took them out of the bathrooms themselves, so we still have that the sanitizer going.
Okay.
Do we have any further questions for Mr. Cheney? Okay, if not, if there's no opposition, I think Mr. Cheney has direction to go ahead and act as he's proposed. Any opposition? No? Mr. Cheney, go ahead.
Okay, thank you.
Great, thank you, appreciate it. Okay, the third item of business tonight is legal encampments and wellness plan. This is Police Chief Brian Churchill will be responding. This is a result of the tasking we gave him several weeks ago to look into dealing with the homeless in a more robust fashion and dealing with wildlands fire mitigation. Chief, welcome. You have the floor.
Thank you, sir. Good evening, Mayor and City Council. I appreciate the opportunity to be here. This is something that I think you're all well known that is near and dear to my heart. It's one of the reasons that I came to Manitou, and I think it's one of the reasons that I was brought here. So when I was tasked with this, I saw it as a great opportunity to implement something otherwise may not have been available. And so what I've got put together is 3 options. Option number 1 is the option that you received in the packet. That's the PowerPoint that I'd like to go through. That is the full meal deal. It addresses not only the problem of homeless camps and illegal camping, but the people in those camps, how to address those issues, how to partner with social service entities, bring the powers to bear to help people solve the issues and the crisis in their lives that gets them down off the mountain. Because if we're just treating the tent, the problem's not going to go away and you're not going to solve anything long term. So option 1 is the ultimate option that not only addresses illegal encampments and fire, but takes care of our entire community. And that's what Manitou is about. This option addresses wellness, behavioral health, quality of life for our entire city. It works on those issues that eventually end up in somebody being homeless, and partners with the new entity, the Beehive, to keep people connected, to follow up, to raise quality of life so that long term we reduce the numbers of homeless in Manitou through service and support and through making being homeless non-sustainable. So I'd like to go through the PowerPoint, go through all those options. Chief Forsett, I believe, is also connected to the meeting, and he's got a slide at the end that he'll be able to talk about the fire department side of this. Then I'll present option 2 and option 3, which are both scaled down, less costly options and reduced service and support options, but still focus on the primary objective to this presentation that I was tasked with for tonight, which is homeless encampments. And then the last slide is open up for conversation, input, questions, and then I'll be happy to take notes and start working on answering those questions over the next week or so. But I think you all have been well briefed on this. So my goal is that as a community, as a city council, as city staff, that this becomes a discussion on how do we best utilize the resources we have, in your opinion, to accomplish the mission set for us. My presentation is the public safety side of our city and what our current most pressing problem is. So, Judy, are you going to bring up my PowerPoint, or do I need to share screen?
I've been prepping it, so if you're ready, I can do that.
Ready to go.
Mm-hmm.
And I'll try not to kill you by PowerPoint. There's like 27 points here. I've added a couple since we first listed this. All right, are you going to go this way, or are we going to do just the full screen slide?
Give me just a second here. I got it started. I got on the wrong one. Let me just switch it to the full screen.
Chief, did you send her your latest one?
I probably did not. I was planning on showing it myself. So once we get to that point, I can share my screen, or at least talk about the latest additions. And the latest additions are prominently are more or less showing manpower, resources, encumbered time versus unencumbered time, in justifying why I'm talking about some manpower. But so our proposal is we have homeless camps on our mountain, people in town. We have quality of life issues, crisis issues, wellness issues. And it is for anybody in Manitou Springs that looked up on that hillside and saw that smoke that night, including myself, you realized immediately that this is a clear and present danger and an issue that has to be addressed. So when I was tasked with this, I looked at how do we address that issue? And the issue is not the tent, it's not the camp, but it's the person in the camp. And in order to eliminate the numbers of camps on the hillside long-term, you have to address that person. So a little bit of this PowerPoint is a play off of the Beehive, because I see this unit, if it goes into effect as written, would be a daily working entity resource liaison with the Beehive. So I've played on that bee theme with the beekeepers. And it's the beekeepers because this is the partnership within our town that will be responsible for our community with going to those radio runs, going to those medical runs, and connecting people in crisis in real time and follow up through reading the reports and going back to people the next day and bringing them into the resources that the Beehive will offer. So next slide. So mandate, and I hope Councilor Bremen doesn't mind that I borrowed this from him, but I was copied on an email that he sent to one of his constituents addressing this problem. And I think he said it so well, and he captured the idea of my presentation that I made it slide number 2. And he talks about there are 2 problems here. One is the encampment and the tent, but the other side of that problem is the person. If you don't address both, you're not actually working on the problem or solving anything. If you're just going after the tent, what somebody said that I agree with is you're playing whack-a-mole. You remove the tent, the person's still there, they're the next ridge over the next day in another homeless encampment. So I took what Councilor Brimner said in this email as my mandate and drove on from there. Next one. So the next slide talks about the magnitude of the problem here in Manitou Springs when it comes to police and fire radio runs. I had my administrative assistant pull runs. We really don't have a system that does the analytics on this problem specifically, but going through 8,000 different radio runs and combing those reports, she found that approximately 68% of all police and fire runs from October of 2019 to October of 2020 included something to do with a social disorder problem, with an indigency problem, with a homeless problem, with a behavioral health problem. Something in 68% of all of our runs is connected, has to do with, has a need for the presentation we're about to give. I think it says a lot for the need in the call for establishing some type of program like this. Next slide. So the mission, if we hire 3 full-time employees, what are they going to be doing? What's their task? What's their mission? It's to provide a rapid and safe response to behavioral health crisis, to facilitate assessment, triage, linkage with appropriate services, and diversion from arrest. That's what the nation's calling for right now, is diversion out of the criminal justice system when there's a public safety problem into a system that actually addresses the problem that led to the 911 call. It also, primary function is to address illegal camping, do fire mitigation, and proactively address social disorder issues that directly affect the quality of life for the citizens of Manitou Springs. That's the idea. Next slide. Primary objectives of this team: social disorder, and by that I mean substance abuse, narcotics, alcohol, domestic violence, COVID stress, behavioral health problems. This team will be a proactive team for residents and businesses. If you've got a problem, if you're a business and you have an issue that's related to some type of crisis, some type of social disorder, you know who to call. You call the beekeepers. Right now, you got a 911, you get a call, you call in, you get a regular cop off the street, you try to work through the bureaucracy and the red tape with somebody that will try to get you where you need to go, but it's not a specializer in that function. Under this plan, you know who to call. You call the beekeepers, they help you and they connect you through the community outreach manager to the beehive, to the social service entity, to Westside Cares, to Aspen Point, whoever it is that can help you with that problem. They're your connector. You'll know who to call. If you've got a homeless camp on the hillside, you know who to call. If you've got a problem with a homeless person, you know who to call. If you've got a behavioral health problem with your child, you don't need 911, but you need help and you need somebody to come now, you know who to call. And these people will be specifically trained and prepared to go to that run, to respond to it and handle it in an appropriate manner. We've all seen the videos of people around the country. Somebody's got a behavioral health problem, mental health problem. 911, what's your emergency? There's a man outside with a baseball bat destroying my car. He's off his meds. It's a behavioral health problem. Traditional police response, they show up. Next thing you know, you've got somebody off their medication that's got a knife, a baseball bat, rushing you as a police officer. You have no way to mitigate that initial, that immediate danger, except for use of deadly force. This would be the entity that would respond in real time while they're working to crisis and calls like that. They'll partner with social workers, the mental health unit at the Beehive. They'll address homeless camps. They'll do fire mitigation. They'll address panhandling on Manitou Avenue. They will connect our citizens to the self-sufficiency matrix, which is proactive sweeps, proactively engaging our public with a matrix to find out what do you need, what's the problem in your life, who is the resource available in our society that can come to the table to help you with what your problem is. They'll know how to do that. They'll be involved in community engagement. If you're having a neighborhood meeting, if you've got a neighborhood problem, and I see this unit partnering with, say, code enforcement on neighborhood dispute type issues, and we've had a couple of those in recent memory in the past couple of weeks here in town, where it's a mediation problem, it's a neighborhood problem. It doesn't always lend to criminal justice, but this is the community resource that can come assist the neighborhood, do some mediation, do some partnering, and resolve those problems. Code enforcement, they can help with bad landlords, they can help with high grass, weeds, trash, anything that they are going to be the community resource officer. They will deter crime through prevention and awareness. And let me tell you how I really bought into this theory was in my past experience as a traditional cop with as a crime strategist. I used traditional policing to try to fight crime. and all we did was move the dots around the map. The crime stayed, it just stayed in a different location than it was last week because we hammered it with law enforcement. When we implemented community engagement through a behavioral health unit, through community resources, through social workers, through entities that can help people in crisis deal with those crises, I saw those neighborhoods that were high in crime on the social disorder index. Now, I'm not talking about robbery and homicide. I'm talking about domestic, substance abuse, burglary, theft, things like that. Crime in those neighborhoods, when we went in a non-traditional policing mode to help people solve the problems, crime in those neighborhoods went down up to 52%. So this unit in Manitou, you might think this is not big city. We don't have big city problems. We still have crime. We have social disorder crime. This unit will help the citizens in our community resolve the problems that lead to disturbances, that lead to petty crime, to lead to those type of issues. It will raise quality of life, and our crime will go down long term. They'll be trained in behavioral health, substance abuse, and they will be the ones that can provide you the resources that are available in our community in real time. This is who you need to call. This is who can help you. This is what's available. If you go to the police department's website right now, we have 3 hyperlinks at the very top that show all of these resources. But if you're having a problem in real time and you call 911 or you need the police and you need help, you're not getting on our website to look this stuff up. This unit will be able to help you in real time with things like that through education as well, long-term sustainability. Next slide. Duties and responsibilities. What are they actually going to be out doing? Quality of life sweeps, proactively hitting our neighborhoods, proactively hitting panhandlers, proactively hitting homeless camps, proactively walking the street, talking the talk, meeting people, providing those resources. Prevention by awareness of indigent. And what that I mean is this partnership will know who are our homeless people in town, where do they go, where do they sleep, who is in that community, what's the ebb and flow of it, I haven't seen a particular individual in 2 weeks, they'll know where that person is. If somebody new is in town, they will be tasked and have the daily opportunity to engage that community to know who these people are. You got to know what you got in order to be able to address it. Resource referral, social services. Again, that's partnership with the Beehive. Address uncooperative property owners. So we got a property with a rental house owner who is not taking care of the tenants, not taking care of the property, not taking care of their duties and responsibilities as a landlord, and it is harming the quality of life for that neighborhood. Then in partnership with the code enforcement officer, the beekeepers will be the law enforcement and social service responsibility that will address and be responsible for and will be tasked with ensuring that that problem gets resolved. Because a lot of times what happens is you have somebody in a house that's acting up, they need help with the issues in their life, right? And sometimes some of those issues can also be the landlord not taking care of business. This is the unit that's going to work on things like that and partner with code enforcement. They'll do education of the public. They'll attend community meetings. They'll address domestic violence. If an officer goes to a domestic violence call at 2 o'clock in the morning, it's going to be the beekeepers that show up at 2 o'clock the next afternoon and say, how do we help you? How do we help you fix the problem that led to that domestic? What's your situation now? What resource do you need? How do we address this? It keeps the recidivism rate of domestic violence down, and it provides opportunity for people the next day to solve that problem that led to that violence. The organized events such as hive drives, which could be food drives, clothing drives, a Christmas toy drive, anything like that, partnership with the Beehive through social and other social service entities, they will be the element in our public safety branch that partners with the Episcopal Church for things like that on food giveaways. They'll be the responsible entity to do that. Coffee with a cop, things like that. Organized public assistance in emergency. Say we've declared a disaster because we've got a fire, we've got a flood. The vehicle I envision for this unit would be some type of van along the lines of maybe American Pickers. So that type of van. So if we have something, we have a family that's been flooded out because of the latest water main break. It's the beekeepers that can show up and help move them. It can help get them to the resource. It can help get them to the place to stay overnight, to the resource in Colorado Springs that has an apartment or a hotel for them. For medical assistance, a lot of these runs that we take that are part of that 68% have a medical connection to them. That's where the paramedic side of this comes into play. Not only the fire mitigation, the fire knowledge, but the paramedic and the medical side, the behavioral health side. Relieve stress from citizens on officers. And what I mean by that is, to a lot of people with behavioral health problems, this uniform, what I'm wearing right now, is in of itself a trigger. It heightens the tension, it heightens the stress, it heightens the probability for violence. So if you have a situation, and we had one at the Beehive 3 weeks ago, when one of our residents went down there, one of the things he said was, "I don't like the police." We know that he gets triggered when the police show up. So it is not always appropriate for public safety to show up in uniform. The beekeepers will be in khaki pants and polo shirts. They will not look like traditional law enforcement. It helps soften that mental image, that visible image, when they're addressing a problem. It lowers instances of violence toward law enforcement, and lowers incidents of arrest when it comes to those in crisis. Next slide, Judith. So who are these people? One would be a police officer, a detective, full-time police employee, detective, fully certified post-police officer that I would designate as a detective to work on all 68% of those cases that evolve into reports that have something to do with what we're talking about here, to follow up and investigate and to connect those people the next day, the next 2 days, and make sure they're getting the resources they need. One's a police officer. The other one comes from the fire department. It'll be a full-time paramedic with specialty training on how to deal with behavioral health, how to deal with those type of medical runs, and how to deal with fire mitigation and things related to homeless encampments. The third one, the core manager, and core stands for Community Outreach Referral System Manager. This takes a lot of administrative work to connect with all these social service entities. The administrative part of this job would be handled by a civilian employee. I think there's a couple options on how we can manage this, but it is the civilian city employee that liaisons between public safety, the city of Manitou Springs, and the Beehive, and through all of the other entities. If a cop takes a report of a person that's indigent one day and they get referred to the core manager, it's now the core manager's responsibility to ensure that that person gets the follow-up, gets the help they need, and and that it's sustained. So basically, they'll run a caseload on people in our town that find themselves in need of food, find themselves in need of employment, that need a flu shot, whatever it is. This is the civilian employee that ties it all together. The public safety end to the civilian end. This is the employee that makes that go around. So all in, if these are 3 city employees, I sat down with Becca one day, and she's been working on budget and a lot of things. She carved out some time for me, and these are quick numbers. Rounded up, rounded down, just as close as possible. Salaries and benefits for the police officer, the fire department, paramedic, and the core manager, equipped, and by that I mean uniforms, training, guns, paramedic bag, all of that stuff. And with money for the car to get started is about $280,000 startup. That'll go down a little bit the second year, because once you've got your equipment, you're not buying it again. But first year, all in, somewhere between 280,000 upwards, maybe 300,000, but that's the ballpark. Currently, what we spend is we have in our LEAP budget going into this next year to do this on a part-time basis, as we were doing. It was put into the budget prior to this presentation being directed, was $10,000 is the current budget for a part-time, one guy on his days off to come in and try to organize and do it. So what are their working hours going to be? They're going to be flexible. Depends on the time of year, depends on the season, depends on the need. I would imagine that the civilian managers, Monday through Friday, probably normal banker's hours. but the police officer and the paramedic, maybe like a day tax shift starting at 10 a.m., working 8-9 hour shifts, whatever we work out, but it's going to be flexible depending on the season, depending on the current problem. If they are taking the next week, the next 2 weeks to start focusing on homeless camps because we've gotten into a warmer season, then they're going to be in a position, part of the perks of the job, benefits also comes to need to be flexible, is they will be tasked in detail to work the hours that would addressing the homeless camps would require. And a lot of times that's going to be at night. People in camps aren't there during the day. They get up early in the morning, they hit the bus, they make it to Colorado Springs, and they don't come back till the middle of the night. So there's going to be some nighttime operations to go along with this. So completely flexible, mission directed. All right, next slide, Julie. Judy, make sure I keep up on mine here. So these are just some of the things that I see them using as part of being successful. I think some of the things on this list, once they're up and running, can be purchased with a grant. And from our research, it looks like grants are easier to get if you have a unit established that's working full time, that you can say this grant is for this unit and here's what they do, who they are, how they operate. I think up front, though, they'll need a minivan of some type. It's a van that is not a police car. A lot of people won't call the police, won't ask for help because they don't want that black and white police car showing up in front of their house. The neighbors talk, it goes on social media, it's a detractant. So this car would be unassuming. People will know who it is, but it won't be an impediment to doing our job. And it will be functional in the manner that you can do some medical assistance, medical work in it, and you can transport a family of 4 with their luggage to where they need to go. I see a drone. One of the biggest problems is locating these camps. It takes a lot of time. Our current officer that does this will come in on his days off and he'll spend 4 hours doing nothing but what he calls locates, walking that hillside, trying to find camps, looking for people. So a drone, and I come up with this because I got a friend on another department that them and the fire department partnered and got a drone that's got forward-looking infrared FLIR system in it, so that at night, this partnership could park in Bar Trail parking lot with a infrared drone and fly that mountainside at night. GPS coordinate all of the hot spots they see, all the camps they find, just based on the fires or the people. You can see people sleeping through one of these things too. So you can pinpoint at night where they are. I think a drone could be used for that. Plus, you can see them being put to use for lost kids, lost people, medical runs where we know somebody's down somewhere at Bar Trail, but we don't know exactly where. This partnership would be brought to bear for that. The medical, all of the paramedic EMT equipment would be purchased through this program for that additional paramedic that's coming onto the fire department. Unique uniform, I see khaki pants, a polo shirt, something that says who they are without necessarily always saying what they are. It relieves some of that stress. Anything else we find that's a job related specific item, we'll grow into that, we'll know, but hopefully grants can sustain us through that. And then training specific to this position. CIT training, crisis intervention training, behavioral health training, conflict resolution training, community engagement training. I would like the police officer to be an EMT. I would look for somebody that has those qualifications or that's willing to go through that training. So this would be a police and fireman working, or police woman, firefighter working together, but have the opportunity for specific training to that job to help make them successful in what we want them to do. Next slide. Budget cost current. Make sure I'm with, okay. So currently in the budget, we've got $600 per day set aside for cleaning. And what this is Keep Colorado Springs Beautiful. It's on if it's on a rugged hillside, it's $600 to get them for one day. If it's more flat service and not so easy or not so hard to get there and get stuff out, it's $400 a day. That's what we pay Keep Colorado Springs Beautiful to come in and help clean up some of these camps. And currently going into next year's budget, we have $10,000 set aside for overtime for off-duty officers to come in and do homeless campfire mitigation. Next slide. So we all know Manitou Springs, like everywhere else, money's hard to come by. A lot of people need those resources. And when I started looking into this, I was like, how are we going to do it? Because I know that our real estate property is high. Our taxes, our mill levies are some of the highest in the region. And I know if I was asking for a mill levy, it would be on the backs of our property owners. And I am not the only entity, meaning public safety would not be the only entity that's going to need to derive money from that type of resources. So I looked at sales tax. We're already at 0.903%. That's the highest in the county of all of the cities. To get the money I think I needed to put this into play, get it up and running, and to make sure it's fully funded, it would take a 0.05% increase. That would take us to 9.09. That's almost 10% sales tax. I didn't think that was doable either, because if you think about the businesses and the business owners and the vacationers, it's just not very palatable. So in Monument just tried to do a tax increase for public safety, but they were starting at low 7%. They were going to do a 1.5% increase. They're starting, if you added the 1.5% increase, they would still be below where we currently are. So I didn't see that as a viable option. So grants are an awesome opportunity. There is money there. There's money to play there. I think in the long term that this can help reduce our cost load for this option one, but to get up and running and to make sure it's guaranteed and full time, it's not possible. You can't get those grants right away. And there's no guarantee they're going to be next year. It's just not a continued sustainable resource. And if we're going to do it this way and we're tasked with doing it full time, it has to come from city resources so that it is a job line item. It is a employee line. There's things, emergency solutions grants. And I think those grants will come into play once we're up and running with this idea. Next slide, Jude. So what's left? This is where I kind of ran out of steam. The city administrator took me to lunch and tried to bounce ideas off of her. We discussed through this, and she asked me if I had thought about marijuana tax. And I'm new. I've only been here a year. And I figured, okay, well, marijuana pays sales tax like everybody else, 9.09. So researching it, found out that marijuana has its own tax on top of that 9%. That's on a sliding scale set by city council. So I went back to finance and found the old ballot initiative and confirmed that was true. And I've got a slide coming up, but basically to fully fund option one and then some, a 1.5% sales tax increase, raising the marijuana tax from 6% to 7.5% on current dollars, give or take, puts us in the ballpark of $450,000 a year. What I like about this, it doesn't put it on the back of our property owners. It doesn't put it on the back of our businesses. It doesn't put it on the back of our vacationers, our visitors, our people that like to come here on Sunday and sit down and have a beer. This puts it on marijuana and solely on marijuana sales tax. I think there's a lot of discussion that can be had here, but if you're me looking for a solution to this question, this is one answer to that problem. I think marijuana contributes to some of the problems that we are here tonight talking about. I think there are people that are here and they're homeless. And I think they're here in Manitou because we have retail recreational marijuana sales. So I think this entity if they were to specifically help fund this solution, I think it's appropriate and I think it's good public relations. So another thing that this does too, it's not a ballot initiative. It doesn't take a vote. It doesn't take the ballot initiative. All it takes is a resolution by city council. Next slide. Next slide. This is the original ballot initiative that talks about it. I'm sure all of you are aware of this and already know about it, but when it was established, marijuana sales tax was set on a sliding scale that could be moved by city council at their direction from a 5% tax rate to a 10% tax rate. It can go up, it can go down. It's up to you where that tax rate goes. Currently, it's sitting at 6%. When it was at inception, it started at 5.5. It's only been moved 1/2 percentage point since day one. So you have not tapped into this before, I believe. I think other than one time, and that was 0.5%. And if you remember, when COVID started, at our own volition, the city of Manitou Springs approached the 2 marijuana retail stores and said, would you be interested in extending business hours from 10 o'clock to midnight? We didn't ask for anything in return. They accepted that offer, and they are now open till midnight. That's been that way since spring, with nothing asked by our city in return. And now I think it's time to ask. I don't know what the additional 2 hours has provided those 2 stores. I know if it's an additional 20% in sales, it more than covers this entire initiative. So I think that's something that can be looked into. And I think I called Becca earlier tonight to ask about this. They report 2 months in arrears. I don't know that we have an answer to that question, or if they even break it down. I doubt they do. But I think total sales numbers between this year and last May, I see Denise saying no, but they've got 2 hours more sales, you know, they're bringing in more money. Next slide. So push this to, just to make sure we're on the right track here and we understood what this meant, I pushed it to the city attorney. Here's a cut and paste of his email response and his opinion on that. It basically agrees with what I've just said. This is done by city council. It is at your desire, it's at your direction, and you can move the tax rate on that scale up or down as you see fit. Next slide. Factors and other information. These are some more just kind of discussion points. These are brand new positions. These are not positions that are currently allocated for, currently open, currently exist. These 3 positions would be brand new to the city, over and above anything currently allocated for. They are specific to local needs. These issues, these 3 employees would specifically address the current climate in our town, the current need in our town, the current problems we are facing in our town. And as point C says, they're specific to the current national conversation. We all know that things are being said nationally. We know what the desiring drive is to move, what direction to move public safety in. This is it. This is what people is calling for. This is what people want to see happen on a national scale. Manitou, in looking at something like this, in fact, in the Beehive itself, is leading the way in moving toward the future of public safety and what that means. Federal Bureau of Justice Statistics. What do they say about our 68%? They say 64% of everyone in jail, more than half of all prison inmates, have some type of mental health problem. Many of those are undiagnosed. So that shows you that Manitou is on par, is on equal footing with what the Federal Bureau of Justice says is the problem. And that is 64 to 68% of everybody that ends up in the criminal justice system shouldn't be there. And that's why there's the national conversation of going in the direction that Manitou is talking about going to. What are 2 other reasons? This is the right thing to do. It's the right thing for our citizens. It's the right thing for the homeless. It's the right thing for everybody. Everybody in our town at some point or another, especially under COVID, has a need to ask for help. This is the right thing to do. And it's money well spent. if you're going to, and I'm looking at this from a public safety perspective, if you're going to spend money on the police department, if you're going to spend money on the fire department, and you're going to spend money in a public safety mindset for Manitou Springs, above and beyond what we currently do, and in the police department, what we currently do is we're trying to get the minimum staffing. This is money well spent. This is what defunding the police means, right? You're redirecting the focus of law enforcement into a path that addresses that 64%. Next slide. So who benefits if we do this? Everybody. The residents, they know who to call. They know who's here to help. They have a resource every day that's in town that can help specifically with any type of life crisis. The businesses benefit. They have a resource. Somebody that's here in our town every day tasked with dealing with panhandling, with people that are indigent, with problems on the street, with problems that businesses may have when it comes to vagrancy or any other quality of life related issue. And this does not take any money out of their pocket in funding it. All local government, this helps the city in any type of public safety way. It allows the cops to stay on the street. It allows the fire department to stay in service, to respond to the runs that they are built and designed to go to. And it takes the problem off of City Hall. When you don't come to the City Hall anymore, if you're having a crisis, a life's moment, you know that you can go to the beehive. You go to the beekeepers. That's who's here to help you. And I tell you what, it's already done, what the beehive has already done, and it builds trust. People trust this type of unit. They're already on Tuesday morning. Right now, we're only open at the beehive on Tuesdays. People are already going to the beehive, showing up there when they open because they know they can go there to get help. If they're in a crisis, if they're off their meds, if something bad has happened, if the weather has changed and they've frozen the last 3 nights and they haven't slept, they don't act up in the middle of the street anymore. People don't have to call 911. It doesn't take our entire fire and police department out of service. They know they can go to the beehive. They know they can go to the beekeepers and get help with those problems. They know where to go. And that is the crux of all of this. If you build trust and you know where to go to get services, to get solutions, to get help, once you have that trust and you're getting that help over time, you get off the street, right? That's the idea. Over time, you get out of that tent, you get off that mountainside, you're no longer heating your camp at night at the sterno stove out in the middle of the forest. You're in housing, you're in transitional housing, you're in Colorado Springs, you're where you need to be because you trust the people that are here to help you. You've had enough exposure that it's gotten you back on your feet and you're deciding to get out of that homeless camp. So it helps them too greatly. Next slide. What else does it do? What does it do for public safety if we have these 3 people working? It helps code enforcement. She'll now have a partner to help her. And if you look at it, at the code enforcement problems we have, a lot of those have to do with what we're talking about here tonight. It's a behavioral health problem within a house that has caused a neighborhood dispute that has led to issues that cause public safety, city council, and everybody else time and effort to try to address. A lot of these are code enforcement problems. And there's going to be there's a lot of times she goes out and would need some backup and needs some help and somebody that can help her solve a problem that she runs into. This is the people that do it. Fire mitigation, they're going to be up on the hillside. They're going to be doing the homeless camps. That takes that run off the fire department. And this is going to be a full-time paramedic. If we have a person that goes down on the incline at 2 o'clock in the afternoon, 5 o'clock in the evening, right now it takes a fire truck and probably a cop going to go up there with them. If the beekeepers are out working, they've got their own vehicle, they've got their own paramedic, they've got their own resources. They can be the ones to go up and address that problem. The fire department stays in service for what the fire department is meant to be and meant to be doing. Police calls for service. Like I said, I don't see this as being an immediate reduction in that 68%. They will take runs in real time. If we have a have a disturbance in the street that has to do with somebody that's having a behavioral health problem, they can take that. Where this helps is long-term, they follow up on the runs the next day. They start getting our frequent flyers, our repeat callers, our I call 911 every other day to help with this issue. They start dealing with those issues that over time, that 68% run load becomes 48%, 38%. It goes down over time. Like in my past experience, when we started dealing with communities, neighborhoods with these issues, with this type of unit, 3 months later, crime had gone down 52%. People knew who they could call, what resources were available, and how to handle problems without acting out. And it helps with fire calls for service. There is a paramedic out on the street that can handle low-end runs as a paramedic working with an officer in real time. You can also see this unit coming into play on things like coffin races. They'll be out there working if we have a problem, if we have somebody go down with heat stroke, if we have somebody go down because they have too much to drink, this entity will be working and they can handle that and address that. Next slide. And you can probably pop through the next two. These are the news articles that were in the paper. That got this started and created this opportunity. I put them in here because when it comes down to it, this is why. There was a fire on that mountain. And when I first got there, I thought we're going to have to evacuate Ruxton and Crystal Hills right now because this ain't stopping. I mean, it was really a wake-up call on how to do this. And then the next slide, I don't think you have on ours. Judy, is it possible for me to share my screen?
Yes, you can do that. I can stop sharing if you're ready to start sharing yours.
Yeah, I have a couple of slides we've put in since this was uploaded. I'd like to share, and what these go into is our current schedule. What do I have to click to find?
Share screen,
Oh, okay. Share screen.
and then you'll say start.
There we go.
There it is.
Share. And then let me get down to this. And this is going to help with option 2 and option 3, showing this current screen. And I wish we were in person. It'd be a lot easier to line this out on a whiteboard and show you what I'm talking about and how our operations are here in the police department, but did the best I could with the PowerPoint. This is our current staffing in the police department. I'll go left to right. We have 2 shifts. They call them sides of the week. We have Sergeant Savine's guys, 4 officers. Sergeant Ballard's side, 4 officers. One shift works one set of the week, and then the next shift comes in and works the other set of the week. So we have a sergeant that works 1 p.m. to 1 a.m. He's responsible for 4 people. 2 of those people work 6 a.m. to 6 p.m. The other 2 people work 6 p.m. to 6 a.m. They work their set of the week, and then Thursday through Saturday. If you start Sunday through Tuesday, it's Savine's shift, and then you get Thursday through Saturday, it's Sergeant Ballard's shift. You have 2 guys working in the morning, 2 guys working in the evening. And then right now we have 1 swing shift officer, which is Rathbun 3 to 3. So what that means is if any of these guys take a day off, go to training, get sick, go on vacation, have court, we're down to 1 officer on the street. If anybody at any time is gone. So what has gone on for the past several years is that when there is a hole to be filled, one of those 2 sergeants, or Sergeant Warden, the administrative sergeant, flexes their hours and they come in and they work the day shift hours. And then they'll work the evening hours. They'll cover those holes. So it has been put on the back of these police officers for as long as anybody can remember to fill in and to cover, and it's worn them out. I think you've all seen it, the assessment from 2019. I didn't make a PowerPoint on this. I think it's something we could discuss outside of a meeting, but it goes into detail of the issues that continually working 12-hour shifts rotating back to back, a day shift, 12-hour shift, a late shift, 12-hour shift, flip them around the next day, coming in for court, coming in for like this week, job interviews. It wears people out. And that's one of the reasons why we've had high turnover. But right now we don't have anybody extra, nobody extra. If one person leaves, we have a big hole to fill. So last year, going into 2020, we were going to fill the underneath swing. You see there's 2 openings. Those are on the manning table. Those are already bought and paid for. Last year, going into COVID, we were going to hire those 2 spots, but because of COVID, to reduce our budget, we refrained from doing that. So again, for another year, our officers have come in on their days off to fill in those 12-hour shifts to cover. So we're getting those 2 officers in January. We're currently doing a lateral hiring process, and we're in the making effort right now to hire those 2. What that swing shift does with those 3 people means that from 3 p.m. to 3 a.m., we have a cover that puts 3 cops on the street during our highest run load times. You have the back end of the day shift, the front end of the late shift, and you have 3 officers. So what that means is if you have an arrest, it takes 2 officers. You still have 1 police officer in the city. If you make a traffic stop and you're out for a while dealing with an issue that comes up from the traffic stop, you still have 2 officers in the city. If you go on a domestic run, any in progress radio run takes 2 cops. So during our peak hours, once we get going in January, every radio run will not eliminate our entire police department. We'll still have 1 guy on the street that can respond to things. So that's where we're going. That's full staffing. That's the plan for January without this proposal. So that's what this proposal and my other 2 options are based on, is this current schedule right here. So that was option 1. That's the full meal deal. It's the Cadillac that treats holistically all of the problems that lead to, related to, and derive from crisis, life situations, and homelessness. It addresses them for the entire city in a manner that is effective, that will reduce crime, that will raise quality of life, and that leads Manitou in the direction that the country's calling for. It does it well. There's a funding mechanism for it. It will lower crime. It will raise the quality of life in Manitou, and it will reduce our exposure to fire hazards from homeless camps up on the hillside. Now, I understand that there is a need for other options because funds are limited. This is one option the city can go in based on what resources we have. So I've come up with 2 other options, and they are in succession a scaled back version of option number 1. They're scaled back by manpower, resources, time, and money. But before I get there, before we go on to the next 2 options, because the fire department is a huge part of this, I would like to invite the fire chief, John Forsett, to come over and discuss what he sees the paramedic from his fire department can contribute, what they can contribute to this partnership, to this idea, the endeavor, and to the citizens of Manitou Springs, should this be put into play. Judy, you want to bring John over? And do I have to stop sharing?
Yes, he's already been over since the beginning of your presentation.
Okay, I didn't know I had to hit the stop sharing button, sorry.
Yeah.
I'm sorry, Judy, I'm used to you controlling it during council. So I apologize, I didn't realize that. I don't have a presentation, a PowerPoint like Brian did. So you're just gonna have to look at this. Without the PowerPoint, obviously Brian wants me to share with you what this program looks like from the fire department's perspective and what this paramedic might be doing on a team like this. So aside from a PowerPoint, if it's okay, if you'll just let me read from my notes, that way I don't miss a thing. I'll just cover what I believe this looks like. So the fire department's uniquely positioned to take advantage of having membership in a critical response team like this. Having a paramedic available on a daily basis provides continuity across all of my shifts so that everyone would be equally aware of what the community health needs are. The paramedic would also be available on occasion to support the fire department and its mission by providing advanced life support, medical evaluations, and treatments that can stabilize the critically ill or injured community members and to reduce morbidity. A paramedic on a team such as this can add significant value by providing post-hospital release follow-up, meaning assisting community members with obtaining and being compliant with medications, managing appointments, and providing medical evaluations that help reduce our critical responses in the hospital's readmissions. For some specific patients, a paramedic could provide education. These kinds of circumstances might include patients with hypertension, diabetes, congestive heart failure, COPD, fall prevention, many things. So the specific care that we would have education available to include resources for our repeat 911 callers, homeless and mental health resources could also be provided. And some of these efforts would include health services to underserved populations by providing medical evaluations, disease management, prevention and wellness, and mental health checks, of course. In all of these circumstances that I talked about, a paramedic would conduct point of contact lab testing, possibly interpret blood chemistries to support sepsis alerts, and obtain urine samples for drug use, heart monitoring, etc. All this helps determine underlying issues prior to all the psych evaluations that we would have with these mental encounters. This team as a whole would support the fire department with crisis response, psychological evaluations, crisis hotlines, and more. And just like post-hospital releases, follow-up care can be provided for patients who have had or who have experienced crisis and now are returning back to the community. Finally, the fire department's currently in a very unique position because of a grant that's been given to Teller County EMS and under the guidance of our physician advisor to start to provide telehealth. And we could start providing that as early as December 1st. Got some things to work out, of course, but what that would look like kind of would make me nervous under our current staffing levels, but we could respond to any number of our medical incidents and provide a telehealth environment where we would actually be doing the hands-on examination with a doctor on the line and provide teledoc services. So there's some things to work out there, but with the extra staffing of a paramedic, something like that really does become realizable and something that we can provide to the community. So basically, I'll turn it back over to Brian. That's how I kind of foresee things, though, with the fire department's involvement in a team like this.
Great. Thank you, Chief Forsett.
Go back to
Chief
share
Churchill,
screen.
back to you.
Thank you, sir. So that's where we are right there with our current manning table. That's how we operate. We are at minimum staffing at best, and using people off duty to come in and cover what just to keep two cops on the street. I'm going to skip down real quick. I'm going to show you what our current encumbered our patrol workload is. If you just take radio runs, our encumbered time, which means a cop's time dealing with a run, is 41%, and then 59% of unencumbered time. When you factor into that the report writing we have to do, the time doing administrative work, the time that Gary Johnson, our current LEAP officer that deals with this issue, spends on the administrative task of coordinating homeless camp cleans up, when you factor all that stuff in, our encumbered time that our officers are out of service on a daily basis is 76% of the time. The International Association of Chiefs of Police best practice model, and I've got best practice model, sorry, is committed time should be 40%. Currently, we're about 76%. your unencumbered time should be 60%. So that shows that we are below staff at our current model. So that I wanted to put that on there to show the need for those 2 officers that we've talked about for several years now, putting them on the street. They are here to design to eliminate that slide right there on the right, the 76%. So going into that, option number 2. Option number 2 would be the elimination of the beekeepers. You remove the paramedic and the social worker out of the equation. We forget about the quality of life for the most part, forget about the holistic operation to raise quality of life, lower repeat offender calls, connect people to social services. And this is a focus more on specifically homeless camps and addressing that. And that becomes the mission in option number 2. And option 2 is hire just the police officer as a detective and assign them the task of camps, homeless camps, fire mitigation, and behavioral health detective type work. Anything that falls under that social disorder index that relates to behavioral health or those type of problems, this detective, who would supplement our daytime detective, they would be an evening detective for the most part. They'd be flexible under this program, but for the most part, they would be a detective assigned to work alone on these issues and in cooperation connection with the Beehive as much as possible to help bring that full circle. Some of their duties and responsibilities are below: camps, cleanup, deal with property owners, all homeless related issues. They would be the full-time manager of the current LEAP program and those related resources. They would liaison with Colorado Springs, El Paso County, keep Colorado Springs beautiful, the property owners, the business owners that have camps on their property. They would be a one focus point contact for the community. Currently, a little bit of everybody gets notified of certain homeless camps or certain problems. This particular one detective would be that focus. If you do a see-click fix, if you email the homeless camp LEAP email address, if you have a problem with behavioral health, you know who to call. It's this officer. You know who's responsible. It's this officer. If I have questions or concerns, if the city does related to homeless camps, we know who to call. It's this officer. This is your job. It's full-time. You're responsible. Coordinate it, make it happen. They would liaison with the Beehive to make those connections. I've already discussed that. Serve as an additional detective. It helps the police department by taking all the behavioral health related, social disorder index related type investigations off of our general detective, and they would pick that up, and that would be in order to make this a full-time job, something that can be 365 days a year. What it does take, though, is utilization of on-duty manpower away from the street to go address all those other problems we're talking about. And that's if we come up to full staffing and we have those 3 swing shift officers. What that means is every day you come to work, if we're fully staffed, nobody's off, there are going to be a couple of evening officers that this detective can utilize on duty, not on overtime, but we can flex their hours to go up and do homeless camp mitigation, to do locates, to find camps, to go up in the evening to find the people in the camps. We're no longer paying as much overtime, but we would have the manpower available to take away from the street, to take away from our core function, provide them, supplement them to this detective to go out and focus on the homeless camp initiative. Funding for this, 1 additional cop, salary, car, uniforms, all of that stuff. So it eliminates the 3, eliminates all the other equipment needs. It takes the salary of 1 more cop combined with the 2 that we're already have on the manning table that are supposed to start in January, and takes them off the street, because we'll have that little bit of that flex, puts them together to go accomplish the core function of this presentation, which is fire and homeless camp mitigation. So give or take $100,000 a year, salary, benefits, training, equipment. Option number 3. Option number 3, has no financial increase to the city budget other than the LEAP program itself. It's not hiring any additional cop at all. It takes one of the 2 officers that would be on swing shift now, takes our problem back to being understaffed, being minimal staffing, but one of those 2 new duty positions would not go to swing shift. It would become the LEAP flex detective, the LEAP officer, and they would be given kind of a hybrid duties and responsibilities of option number 2 without the additional resources of the on-duty manpower. So this would take option number 2, eliminate the on-duty in less need of overtime, but it would take the LEAP program that we currently have, and this officer would be your sole point of contact, the responsible party, the one that would organize it, the one that would liaison, the one that would do all the administrative planning to find the camps, go to the camps, get the resources to come to bear, the property owners, the business owners to eradicate the camps, and then utilize off-duty manpower of officers that would come in on overtime on their day off to supplement this officer to go locate camps on the mountainside, to help eradicate camps, to engage homeless populations up on the mountain and help eliminate this problem. So that's option 3. It puts a lot of the weight back on current police officers, but it does provide a full-time officer that is responsible and held accountable to address homeless camps and the fire problem on the Hill. That's option 3. And that may be a bump in the LEAP that's going into 2021. We have $10,000. So if you're paying, and we're ramping this up, so we're having an officer that's addressing it full-time, there will be an added cost, but it'll take a little bit more money being put into that LEAP program. So those are my 3 options. If you looked in the, for a little more in-depth information in the upload to tonight's presentation was the beekeeper's goals and missions, and then duties and responsibilities. That's a little more in-depth detail that you have to tell you about what these officers would be doing. But that's my presentation. On my last slide here is option number 1, addresses everything full-time. It's good for the city. It's money well spent. It addresses this problem, brings the instances of what happens in our community down. It raises quality of life. It provides for the type of community that we all who live in Manitou Springs to have. And I think it's the right thing to do from a public safety focused perspective. The smaller scale options, especially the Corps manager, I would like to talk to you offline if you're interested in knowing more about that job. But that civilian employee is what ties it all together. It's what brings the resources to bear tomorrow and the day after. So having that, questions, ideas, be happy. You know, the community has really bought into this idea of the beehive, what it stands for, what it means, what it can do. Some of the things that have been thrown out there, it's the beehive. We have the beekeepers, in and of themselves, they're the busy bees because they're going to be busy doing what they're doing. And they'll implement things like hive drives and you know, just it's unlimited how you can play off the beehive theme. But the community is buying into it. They're believing in it. It's bearing fruit, and it's really only up and running right now, 1 day a week, and we're already seeing the benefits of where this would take us into the future. So I'll stand for questions. I'm sure John Forsett will too. I'm ready to write down ideas, opinions, questions, and I'll be happy to address those as we can.
Great, thank you, Chief. Council, I think this is a great opportunity for us to ask questions. Would anyone like to start off? Councilor Wolf?
Thank you. How much is the drone?
Depends on what you buy. The one I looked into, I get solicited for them all the time. the good drone, the drone that can do fire mitigation, the drone that can find people at night on the mountainside that are lost, the drone that can fly over a house for the fire department and find hot spots when the fire's not burning through the structure yet, can be upwards of about $30,000. But I think we can get that on a grant. I don't think that's going to come out of our budget. I think once we're up and running, I think that will become a reality through grant money, through federal money, through CARES money. I think there's a way to find that. And one of the training things that I didn't talk about in this would be that our two busy bees from option number 1 would be certified drone operators for our city. So you can see where that could benefit as well during our events we have in town, like coffin races. We could put a drone up over the town with a licensed legal operator of that drone. Lost children, lost people, fires, all that stuff we would benefit from.
Thank you.
My budget, though, does not include the price of that drone. That's going to be grant.
Councilor Chandler?
Yes, I just wanted to say just a few minutes worth of information about the Beehive, just so that council knows how this segues together. And then I do have 2 quick questions. The Beehive now has Aspen Point with one case manager, a counselor, and a COVID resource officer 1 day a week. We also have a staff of 2 volunteers, of which I am one of them, and we will be adding Tessa 1 day a week next month. In a little over a month, Beehive volunteers, including a very core of about 5 people, and Chief Brian have started from scratch. We started from nothing, and we have incorporated into a 501c3. We've written bylaws. We have a board of directors. We have an EIN number. We did all this with volunteer staff. We also have restorative justice that works with individuals who are already connected in the criminal justice system. I do want to tell you that I was present when we had the gentleman that was in the street when I was there on last Tuesday, who went into a manic presentation, perhaps was delusional and paranoid. We came very close to having to call the police, but we were able to, in a 2-hour period, de-escalate this individual, find out what he needed, find out that, basically he was malnourished, insomniac, who is homeless, and we were able to hook him into some services. The Beehive is going to expand in January to include, but not limit itself to, we have a psychotherapist, a PsyD, we have a nurse practitioner, we have licensed clinical social workers, but we're going to be expanding into the community with art therapy, psychotherapy, psychodrama, poetry therapy, art therapy. We're working with the school district, and we're working with Partners for Healthy Choices. So we are going to have a healing arts element to our offerings. Our current business model, however, is unsustainable. We cannot continue to ask our volunteers to give 20, 30, and 40 hours per week of their time, which is one of the reasons why we are very interested in working with the police department to bring on some more resources. And we also truly feel that if this expands enough, we will grow out of our present building and need a larger facility. And this one always catches everyone's interest. We do have potentially someone that we're contacting that might be interested in doing a documentary on this unique program we might be offering. So that's always something that gets people's attention, but it's not sustainable. And we're looking at a business model where we're probably going to have to hire 2 people who are paid to do the work of the Beehive. So I just want to give you a little bit of background of what's going on over there. It's really growing by leaps and bounds, and we need to work closely with the police, fire, and social services in with our regional neighbors as well. So, of course, I'm a fan of Plan A. That said, I have 2 quick questions. First of all, Chief Brian, the 68.3% cost I'm sorry, the 68.3% of your calls in a year's period that were indigent related? Is that what I'm understanding you saying on that slide?
Yes, had some type of behavioral health, homeless, some type
So
of
do
social disorder related problem
Oh.
that unit could follow up with.
Okay, do you have a cost? Do you have a approximate cost of what that cost the city for that percentage of calls? Is there any
I
way
don't
of quantifying that?
I don't have a dollar amount. I can tell you, those entities are already working, are already on the street, to me. Because I think in human resource times and encumbered time versus unencumbered time, as a police chief, and I'm sure as a fire chief, what it cost us is, let's give the example of what happened at the Beehive when you were there 3 weeks ago. That was 2 hours that you spent with him, that the Beehive spent with him, that Aspen Point spent with him. Traditionally, prior to the Beehive, that would have been 2 hours that the entire police force, all 2 officers that are working our streets, would have been out with him. It would have also been a medical run. They would have called the fire truck out to come deal with him because there's a medical issue there too. There was a behavioral health problem there. So that's 2 hours that the entire public safety element in the city of Manitou Springs would have been out of service dealing with somebody that was having a crisis issue because the weather had changed. They didn't have a sleeping bag and they hadn't slept for 3 nights. And they weren't on their meds. So that saved us. That day, our officers, our fire department, were able to continue with the traditional public safety fire department, police department roles, running traffic, being a visible presence, taking radio runs on disturbances or other problems in our town, and not out of service, waiting on an ambulance to come to town from Colorado Springs to transport this individual to the hospital, which is where they would have ended up going on a M1 hold, so that they could get a sleeping bag and a new prescription for their medication. So that's what it saved us on one run in one day.
Thank you for that. And that wasn't staged, by the way. He didn't know I was going to ask him that question. My second question is, do we have any idea? I know you asked Becca, but my first question is, do we have any idea about what the tax revenue that's been coming in from the marijuana retail shops since we expanded their hours from 10 to 12 p.m.? Do we have any idea how much tax revenue we brought in just in that time, or in any time? Do we have any quantifiable figures on that?
Let me bring Becca over, because there's certain things we can and cannot share due to only having 2 businesses. And so we have to be very careful on this information and what we say.
Okay.
So I'll ask Becca to come over and answer that. And I don't know if we can answer it. So Becca, if we can't, please just say we can't, and that's okay.
I think Becca should be able to address whether that category has changed.
Yeah,
I
right.
don't even know if they even availed themselves of the extra hours, or when that happened, if it happened.
So they fall into the category of other in city. And so when I talk about other in city, I'm usually if I want to talk about how much it's increased, et cetera, et cetera, et cetera, I compare it to 2013, which is before we had any retail marijuana. And I cannot quantify what this increase that's occurred this year has done, because it happened around July 15th, I want to say.
Mm-hmm.
And pardon? Oh, sorry, I thought I heard something. And we receive our sales tax 2 months in arrears. So the July sales tax arrived in September, and that's been broken out into its different categories. And then August came in October, but that has not been broken out yet. That's done by my deputy, and she's got just a ton on her plate. It's just a lot of things going on right now. So what I would be doing to figure out what the change is I would just be looking at July and August as compared to 2013 for other in city. And then I couldn't specifically say, well, this is because of those 2 extra hours. It could just be overall. So it'd be really, I'd hate to say it, but amorphous as to whether or not this is caused by those 2 extra hours. The increase, it has increased.
Well, but during this time in COVID, when most businesses are suffering, we would think that we could at least perhaps extrapolate that there are some businesses, including the marijuana shops, that are, I mean, at least by my driving by and seeing the long lines coming out of the buildings every day, they're doing a pretty robust business. So we can, one can make some assumptions that the added hours are certainly not hurting their bottom line.
That is definitely correct. I would say that this year is better than last year, just from seeing the activity around those stores.
Thank you, Becca. Appreciate it.
Thank you, Becca.
That's all I've got.
Okay, great. Thank you. Councilor Wolf?
I have a follow-up question for the chief. Do you know when your assistant was putting together the statistics about the percentage of calls that are behavioral health related? When you get a call from 2 drunk people beating each other up at one of the bars, is that considered a behavioral health? Would that have been included or excluded? I don't know if you include alcohol-related behavioral health, in which case we're dealing with the bars and not necessarily homeless people. I'm just curious what her criteria was.
So the analytics on our reporting system, you know, we don't have the software to do it in-house. We had to get a lot of our stuff from the county, but that would have been, on its face, would have been entitled a disturbance. But Cindy spent a couple of days going through reports, combing stuff, because this stuff isn't just, you can't pull up the program and check boxes on criteria you want to see. So she had to manually go through 8,000 runs. Now, if she pulled up the run and saw it was disturbances based on being drunk, but then the officers determined that one of them was due to was homeless and indigent and had gotten in the bar and gotten drunk and caused a problem, then she may have found that word within that run and included it in that stat. So the metrics for finding this aren't exact, but how I know that she was pretty much dead on is that nationwide statistics, like I quoted the Department of Justice stat, 64%. In her evaluation, by hand of 8,000 of our city runs, she hit 68%. That is a number, 60+% is a number that I have heard for the last several years. So I know we're running the national average.
No, I just didn't. So does that mean, based on what you just said, that the 64% from the Justice Department or wherever department that was, that they used the same criteria your assistant did? In other words, they didn't include alcoholism as a disorder that fell within the behavioral health calls. They're not going to evaluate if 2 people fighting at the bar happen to have a long-term alcoholism problem. So I just didn't know if those statistics included drunken problems or not. But I guess it's hard for me to ask you about the specific criteria of that 64% statistic.
I don't know. I know that nationally it's been determined that 60+% of all people in jail, in the criminal justice system, are there because of one of those types of problems. It's alcohol, it's substance abuse, it's drug abuse, it's unemployment, social disorder problems, right? 64% of the people in the system, they determine, have a problem that is not criminal mindset in its origin. So that had there been a diversionary program in place, a large number of that population may have been diverted, gotten back on their feet, and not be in the system.
Well, and that's really the the big elephant in the room. That's the $100,000 question, is whether all of this will in fact solve the problem. I mean, we're not going to start coming up with income equalization and solving sexual abuse problems and all these other things in Manitou that are chronic nationwide crises. You know,
Here's what I can tell you.
you can tell people all you want about how free it is to go down to the homeless shelter, but when they tell you, I can't bring my girlfriend, I can't bring my drugs, I can't smoke there, and I can't bring my dog, so I'm not going there. So if we pay all these staff people to explain that, oh, you can go to this place, we'll even give you a free ride, so you don't have to hitchhike. I'm not 100% sure that we're gonna have the that it'll solve the problem or address the issues as significantly. Obviously, it's going to be somewhat helpful, but that's the big question. I guess that's the big social experiment.
That's and I'd like to address it from 2 points. Personal experience. That's why you have a police officer that's involved in this program, because there's a law enforcement criminal justice perspective to it. We need to be compassionate. We need to help people. We need to offer and make available the resources that are available, but you cannot at the same time make being homeless sustainable. You have to take that sustainability away. And you do that in a manner that holds people accountable, that has a criminal justice system that has options to it to apply enforcement. It's not that we've taken a run on you today, tomorrow we're turning a blind eye, or for the next month we are, because you don't call the police again or nobody calls the police on you. But you make it that you're going to comply over time, or you're going to be held accountable for improper actions. Now, currently in Manitou, what happens if you get cited for illegal camping, for trespassing? You get a date in municipal court. You show up to municipal court and you say, I'm indigent, I can't pay, I don't have a job. They continue your court date another month down the road. You show up another month down the road, I'm indigent, I don't have a job, I can't pay. You get another court date. You do that enough times, that court date finally just gets dismissed. You never pay, you're not held accountable, and off you go again. That's making being homeless, being indigent sustainable, because there are no ramifications. There's no way to hold you accountable. Through the justice system that we would put into play here in cooperation with our municipal court judge, instead of getting a fine from the judge on that ticket for unlawful camping or for being indigent, whatever's led to your getting a citation, the judge, through restorative justice, can say, I see what your problem is. Your problem is alcoholism. Your problem is behavioral health. Your problem is this social disorder problem that's led to you being in the position you're in front of me in my court today. The judge, through restorative justice, can sentence that person to attend a counseling session or 2 or 3 at the Beehive with Aspen Point, or through what other behavioral health entity can help resolve and solve the problem that has led to the position that they find themselves in. Now, if you're sentenced to restorative justice, you're not going to jail, you're going to treatment. If you don't go to treatment, if you don't show up to your program, if you don't follow through with what the judge has given you, you're not continued to another court date because of a ticket. You are held in contempt of court. That's where it starts either getting people to comply, or they find another place to go, because it's no longer just a ticket that I can keep putting off. It is a contempt of court in the Manitou Municipal Court, and it becomes a day in jail. It becomes time in jail. With that as an expense to our city, but long-term, that starts to solve the problem of chronic illegal camping, chronic homelessness, because now through this system, we are compassionate. We're here to help you, but we will ensure that you do what you're supposed to do at the same time. Tough love is what we used to call it. And that provides our city the ability that it doesn't have now to enforce our laws. The other side of that is, how do you quantify the success of this? I spoke a little bit about this earlier. My own experience, and this is why I'm before you today talking about this as a cop, because I believe in it, because of what I've seen happen. Now, in a previous life as a crime strategist for a police department, I had a $100,000 budget for overtime and 138 cops at my disposal, and detective units and narcotics units and homicide units and SWAT team and all that to go stop crime in neighborhoods. And what I found was that I just moved the crime around the map. The crime never went away. The people just went to a different side of the street. They went to a different neighborhood. They found a new location to do what they did. And the neighborhoods remained the victims of that crime, and the crime stayed high because people didn't know how to get help. So after the creation of something that we're talking about here tonight, I took those resources and the social service entities and the people that could give you a flu shot or provide you with some food or an employment specialist and sign you up for Obamacare. Took the chaplain and we prayed on the porch with people. We did sweeps where we just gave people fire detectors. We talked about bad landlords. We talked about a landlord that wouldn't fix your furnace, so you were heating the house with your oven. You know, quality of life issues. I found that when I took those people dressed as city council is dressed tonight to those neighborhoods and asked, what can we do to help you? How do we solve your problems? How do we fix the issues that have led to the crime in your neighborhood? I can tell you that I ran the crime numbers 3 months prior to doing that. And then we ran those numbers again 3 months after doing the sweeps and following up. The crime rate in that same neighborhood, as a traditional cop, I could not get to go down. The crime rate in that neighborhood after 3 months was down 52%. 52% reduction in crime in a neighborhood that the uniformed cops could not fight, could not get to go down. It was so dramatic of a outcome that the chief of police at the time, I got copied on an email later. The chief of police sent a email to the real-time crime center, the crime analyst, and said, I don't believe the numbers, run them again. And they did, and they said, this is dead on accurate. Crime in that neighborhood, 10th and Rural, has gone down 52%. Why? Because we help people with the problems. Because the crime in that neighborhood was related to social disorder, to social problems. And that's what was causing the crime. We help people regain their dignity. We help them resolve their problems. And that neighborhood started to band together. They started helping each other, and they started refusing to let the crime come to their neighborhood. And when they had a problem, they knew who to reach out to, who in the community was there to help them, and how to resolve that problem without resulting, devolving into breaking into their neighbor's car, into the neighbor's house, into fighting in a domestic. It helped resolve that. So I know I can't tell you here tonight and tell you what this is going to do for Manitou, but I can tell you that in Manitou, we do have those problems. The problems we have here aren't serious, violent crime problems, but they are social crime problems. They are these type of crime problems that this type of resource eliminates. Crime went down 52% in that neighborhood. That may translate into a 10% reduction in our crime rate. 20% reduction to crime rate. But I can tell you what it went up 100% in that neighborhood: trust, police legitimacy, belief that public safety was there for them, belief that the city council, the city government was actually a resource that could be relied upon to help them with problems, and the knowledge that it ain't as bad as it is. There is somebody that can help me, and I know who to call to get that done. So that's my experience, and that's why I'm a believer in this. And that's what I can tell you tonight. My past experience says, if we do this, crisis will go down, crime will go down, people will, at some percentage, come off that hillside, and trust and belief in me and the fire chief, in our two departments, and in city council and city administration will go up. Satisfactory will go up. It works. That's just my experience, but I believe in it.
Thank you, Chief. Mayor Pro Tem?
Yeah, I don't have questions. I have some comments and discussion points, if that's okay.
Please, go ahead.
Okay, first of all, Chief, you make a very compelling argument. And this is, if we were to do this, we'd have the premier police department in the state and the, a model program that could be copied everywhere. However, then I remember, I come crashing down to earth, and I remember that we have streets that needs to be fixed. and water that needs to flow. And our community is generally in the wintertime about once per week, at least, that people don't have water in our community. And granted, that's an enterprise, that's not out of the general fund. So it's at this point very hard for me. And also I want to say that it went from the direction council gave you to deal with the homeless camps to doing the social services for the entire community and medical services as well. And whereas, again, great, would love to do it, but then I come crashing back to earth when I realize some of the other things that we as a council are responsible for. So some of the guidance that I would like to council to consider as we move forward in potentially giving you some guidance this evening is to phase this, to bring it in slowly, potentially over time, and partnered with that to have a strict or a very stringent evaluation system. I'm a firm believer in iterative implementation and piloting new programs, not just bringing them on, because to bring on personnel is the heaviest expense that a city, particularly like Manitou, a small city like Manitou, has. Full-time personnel is a huge expense, and it's long-term, and it may be perfectly appropriate to do that. But I'd like to see the baseline data, which you have some of, but to put metrics in place, specific objectives with specific outcomes and metrics in place so that we can evaluate the success of whatever ends up being implemented. I also didn't see a whole lot on partnerships in this. I know that the community has been very anxious to partner. For years, the community has been trying to partner with the police on identifying and helping clean up the homeless camps, and that's not progressed very well. And it just seemed, my sense is that we could just, as a community, we could do a lot better with that. So we have community citizen partnerships, we have staff partnerships. How else? You mentioned code enforcement, they fall under you, but are there other, and obviously the fire department you're partnering with, but I don't know, is there any other creative way you could partner and get the support of the rest of the staff on board? And lastly, in terms of partnerships, are adjoining jurisdictions, Colorado Springs, and obviously you've worked with the HOT teams, Keep Colorado Beautiful, and so on. But the county has resources, and I know they're very interested in fire mitigation. So I would like to see some expansion of description of how you would capitalize on partnerships. And then lastly, I won't use the term that has been used a lot this summer, but it would become obvious because there's political and negative connotations with it. But a lot of communities are demanding that their police departments reshuffle their resources to address just the sorts of things that you're talking about. And you have talked about doing that in your course of action 2 and 3, I guess. So I was pleased to see that tonight because it hadn't been in your packet previously. So I would like to see an expansion of the budget more, and I won't say all 3 courses of action at this point, but whatever course of action the council gives you guidance to pursue tonight, I would like to see a significantly expanded budget with that. A lot more description in there. And with that comes the marijuana proposal. And I would say, I'm concerned about just that as our go-to, because that's an opportunity cost for the rest of the city. It's a huge opportunity cost for the rest of the city. And, I could see Public Works wanting, proposing that. It's something of a low-hanging fruit to do this, and it may be completely appropriate to go after that marijuana money. But I'd also say that when you put in your briefing that it wouldn't affect businesses and it wouldn't affect the citizens, it would, because those are businesses, those are very successful businesses in our community, and our citizens use those marijuana stores. So there is an impact there. I would ask that you work with our city administrator, because I think that this also needs to be done very closely in conjunction with the entire city budget. Anytime you pull out a department and just talk about that department's budget, it becomes problematic, in my opinion. so I think we need to assess if there are other places in the budget, and I know it was pretty, to the bone during the briefing last month. But given that council has asked you to go and look at homeless camps, there might be something else in there. So those are the things that I would ask council if we might want to give guidance along any of those lines. And those are my comments for the moment. Thank you.
Great. Thank you, Mayor Pro Tem. Just wondering, we've been at this for 2 hours now. Would anybody be in favor of taking a short break and then coming back and discussing it some more? I see a couple of head nods. So yeah, I've got 8:01. Should we plan on being back about 8:11, 10 minutes? We'll take a 10-minute break. See you at 8:11. Thank you. Let's see. Okay. Okay, John, yeah, okay, great. Okay, we have Denise. Okay, I think we can go ahead and get started again. We've heard from several council members, so I think we're beginning to get a sense of some of our concerns and response and so forth. I guess I'd like to see what the councilors we haven't heard from yet might have to say. Councilman Bremner, would you be able to, could you share your thoughts with us?
Absolutely. Yeah, first of all, I'd like to commend the chief on his proposal. It was very detailed and relevant. I like the full version with the 3 employees. It would be great. And as Mayor Pro Tem Fortune mentioned, it would put us at an example for the rest of the state. We would really be able to get a handle on this problem. That said, I think that we have to be careful raising the taxes on the marijuana contingent, because we want to be careful we don't kill the goose that lays our golden egg. Right. And I think we really need to work with the marijuana stores to make sure that that's not going to be that they're on board with it. And I like the way the chief addressed that. The fact that it would be a good community move, is to put them in good stead in the community. So I think we would need to work with them and talk to them and sell them on the idea. I don't think we should just spring it on them. I also think, I was wondering about the options 2 and 3, where we have you mentioned having an officer, and I was wondering, would that officer also be not wearing, of course, a uniform. He would be more like you were talking about, khaki and polo shirt type situation.
Particularly in option 2, because that is an additional employee. It allows us to get up to full staff with having the 3 swing shift officers to give us that coverage shift. So adding on option 2, it just adds an additional salary, additional police officer. Yes, that would cut that officer free to focus as much as possible on these issues, the homeless, the camp mitigation, all of the partnerships, cooperation, and liaisons to bring the entities to bear to help with those camps full-time on a dedicated basis. And I would have that duty position be labeled as a detective, so that it was by default not considered a uniform position. It would be a khaki polo shirt, plain clothes position.
Okay, and I guess one of the options that I had in mind, which you didn't have as one of the options, was having just one civilian employee, core, as you, if you will, community outreach person. And my idea I had in mind was to have somebody who is more athletic, you know, somebody who's going to get out there in the woods, is curious, who's going to search out these homeless camps. And that's sort of what I envisioned, was having something like that. And then if that person actually does come onto a camp where somebody's actually there, they would disengage right away. They wouldn't even try to approach the person. They would come back with a police officer or somebody else, or paramedic or whatever. So they wouldn't be there by themselves confronting the homeless situation or the illegal encampment. That's what I sort of had in mind. And that core manager would also be responsible for working with the property owners, whether it's Colorado Springs Utilities or whoever it might be, to clean up the camps. Now, the other thing, I think we have a very strong community element as well. People that are stepping up to the plate right now to actually go out and clean up these camps. The fire site, over 2 weekends, a group of about 10 to 15 volunteers hauled out over 40 bags, heavy bags, industrial plastic bags, 44-gallon bags of trash from that one burn site. And they're planning on going out and cleaning up some more this weekend. They're going to go out to off of Intamin Trail. There's a notorious location where there's been campsites that over the years I've seen cleaned up multiple times. That the indigents or homeless, if you will, they go in there and they make a little village. They leave their trash and we go clean it up over and over and over again. So they're going, I noticed this last weekend, I was just up there and the site is now abandoned. The tents are collapsed and there's obviously nobody there. So we're going to go clean that up Saturday. That's probably going to take about 5 or 6 volunteers, I think, and we'll get that done pretty quick. So given the, our budget concerns, we have all kinds of other priorities that we have to do. I know that Denise is looking at, renovating in City Hall. You're in substandard quarters there with your police department. There's all kinds of demands we have that we needs we have. And so for me to commit $300,000 to be, the example for the rest of the state and, have a really good program. I like the idea, but I'm just hesitant, to go ahead and do it right so big right away. That's why I like what Nancy Fortune mentioned, is to go incrementally. Let's start off with the smaller version and work up. Let's see how big the need is, because it might be that, once we start actually looking out there and find out where all these sites are, these illegal encampments, we start cleaning them up, we might find out we don't have as large of a problem as we thought we had. And I think part of it is going out there and, first of all, identifying where all these sites are. And I think we're getting a really good handle on that right now. Because there's only so much territory out there surrounding our town. There's only so many sites that are feasible for these encampments. And once we identify them, we know where they are. We go clean them up. And then that community outreach volunteer, or not volunteer, but employee could be responsible for going out and monitoring, like they have their little routine, go out there and check the sites to make sure nobody's going back. And if they are, then they go back with an officer or something, and they tell them, you know, they can't camp there, or they give them 72 hours notice or whatever it is. So those are my ideas. I really like your presentation, and I would love to do it, you know, full board. I'd love to go with the whole Cadillac version, but I just have some, you know, reservations about that, mainly for the financial aspect. That's all.
Thank you, sir, for the input. And I also would like to thank you for spending time with our Officer Johnson and going out and looking and taking a day with him to do some of those trails and camps and educating yourself on that. I appreciate it.
Great, thank you. Let's see, Councilor Shada, what are your thoughts?
I guess my thoughts are along the lines of Steve Brimner. But I guess I'm not as, I would like to keep this idea kind of going. I think it really has some potential. I don't know whether I'm game for it exactly right now, but I'm very intrigued by it, and I think it's really worthy of a pilot program. And I think we maybe ought to look into some kind of grants or something like that to kick it off. That's all.
And Mr. Shada, just I think to help us understand the flavor that you, I guess, like to move with a pilot program, does that align with like option 1 or 2 or 3, or is that meaningful?
I guess I'd like us to work toward option 1, but I'd like to immediately get started with, you know, something along the lines of like what Steve said, a boots on the ground person who gets out there, assesses these homeless sites, figures out how often are they occupied, what's going on with them, how big of a problem do we have. I like sort of kind of an assessment phase, a real concentrated assessment phase and cleanup, so that we know where we are with this. I guess I'm having a hard time getting a handle on just, you know, how big of a problem we have with that is. So that's why I'm along the lines of kind of Brimner.
Okay, great. Okay, thank you. Mr. Bremer, you have a comment?
I just wanted to mention that this came up in discussions I had with the chief and Denise as well. The possibility of having a contractor, so we wouldn't have a city employee with pay and all the other associated expenses. We could maybe contract with the Beehive to have somebody, that community outreach person, the civilian, be a contractor from the Beehive. That's just an idea we floated. So I just wanted to bring that up.
So that idea, if I recall right, when I assume that to be, would be option 3, utilizing one of the future already line items police officers were getting, and then hire or provide the funds to the Beehive for a contractor through the office of a Beehive to do the coordination, civilian part of this job, the assessment, the liaisons, and then you don't have a city employee with the benefits, but the Beehive would have a full-time employee to partner with the option 3 officer to bring it together, to get it all started and up and running. And
That's
that
right.
also, I like the idea too, because it ties in, it doesn't completely give up on the wellness and the quality of life initiative, because it's tying in the beehive.
Thank you. Thank you. Councilor Wilbrook.
Thanks. I also want to commend the chief on putting together this sort of full scale proposal so that we can kind of go from 0 to 60 and see what options look like, and and how we might want to scale that. Although obviously I'm not sure we want to scale it, but I understand all of those perspectives that we've heard before, and I won't regurgitate them. I guess it's interesting to listen tonight. So it seems like even tonight, it feels like the urgency feels like it's worn off just a little bit, right? The fire didn't consume our town. We have this amazing outreach and volunteer response that's still happening. And a lot of that goes credit to Councilman Bremer for doing that. The weather's gotten cooler. We've gotten some snow. And so it feels like it's, this was something we tasked the chief with through Denise, who kind of, we made those adjustments. But it's interesting to me that even tonight, when we start looking at the money, we start backtracking it. And I guess I really don't have a good feel for where the community stands on that, and I don't think there's that many people on this call tonight. I mean, I'm looking at participants and I'm seeing 25, and that worries me a little bit, because I don't know how we go about doing community meetings during COVID that can be done over Zoom, how we get people involved in that. But I'd really like to hear the community's response on these 3 options and look at this holistically and have that fire experience in their brains. This is a problem that's, certainly been going on as long as I've lived here. In different levels, different seasons, different groups of people, meaning sometimes we have the travelers, sometimes we don't. It's always a problem. I mean, I can remember one year, every night I'd hike the Bar Trail and come down and see 20 people going up to camp. We're very likely in the same area that fire was. So I guess that's something that I'm sensing, and I'm not sure if that's the right reaction to have, if all of that is accurate. So I'm feeling the need for bringing this into the community and talking about it some more before we were to make any decisions about that. I'd like to really get some more feedback and allow the community to maybe ask the presenters some more specific questions about some of this data and some of these expenditures. I also think that I'm not necessarily opposed to asking the community and the marijuana shop owners to increase the marijuana tax. But if we did that, I would like for this to be rolled in with our city administrators. She is our chief budget officer and our city administrator. And I'd like for her to be able to have an opportunity to maybe look at what other things sort of rise to this level of need. And I don't really quite understand what time frame we're looking at. If we were to try to fund this, would we be funding it in a special election in early next year? So I'd like to hear more input from our city administrator, not tonight necessarily, but when she's had some time to consider this. If we were to go this route, what would that look like beyond this program? So that's kind of important to me because I agree with what everybody said about the budget and all the needs that we have. But of course, if our town burns down, these water main breaks will look a little bit more minimized. So those are some things that I would think about. You know, sometimes it sounds really good to be frugal and start with option number 3, but then you don't get very far with option number 3, and you don't get the enthusiasm, and you don't get it going, and you don't get the results that you want. So that's kind of a concern to me. I did talk to the chief about this. I think that this is the work that Judith Chandler's done along with the chief on the Beehive is really, it's come so far so fast, and it's provided so much, I think, potential and hope for our community. And there's been a long-term conversation about having, you know, more of like a community health center in Manitou, because we don't, if we have a primary care doctor, it's, you know, usually lasts very long for whatever reason. And I think one thing that might make this a little more interesting for me and for other members of the community is I would also like to see some kind of private or public partnership with the Beehive. You know, I went down to Safeway and got a flu shot for $31. I would have happily paid that money to the fire department. I don't have an option for anything like a strep test or even a COVID test, or gosh, I think I have a sinus infection. And those sometimes can be nurse practitioners, they can be physician's assistants, it could be a public-private partnership. And it sure would be nice if we could do some of those things here in Manitou, that I could walk down to the Beehive and I could do that. And that $31, as small as it is, would be something I'd pay not to Safeway, but to Manitou. And so that's really kind of an important thing to me. And I don't think that it should be something that's just for at-risk or low income. It should be a way for the community to use those sources and put their money into the community for really simple things that don't require maybe, you know, getting in on your primary care doctor's schedule or anything complicated. But that's interesting to me. And then, you know, well, there's two things. First of all, I'm going to go back to this whole marijuana tax thing. And, you know, one of the reasons that I was opposed to the match initiative was that I felt like if we're going to ask the community to do this, which should be bigger and it should be better. And I've lived in plenty of places where you get asked for things every year, every 2 years. And then you start saying no all the time because you don't even read it anymore, because it's just the way it works. So that was the thing I said a lot about match. I thought that it was something that we could have done more with, and we could have done a better job with it. And so that's the other reason I think we need to really, if we're going to do this, we need to look at all our other needs via the city administrator. My other thing, which is probably not going to be a very popular thing to say, but I'm a fan of sunsets for taxes. Because I think that for them to go on in perpetuity isn't a smart idea often. It doesn't give people the motivation they need who are working on it to really show the performance that it's doing that. I mean, I think if this is what we need and it's working, and we can do this tax, that's great. But we should have a sunset built in, possibly if we are to do that, so that we can reevaluate it. And there's lots of taxes that have sunsets, like the PPRTA in El Paso County, and actually I think that goes all the way up to Woodland Park, but it has a sunset in it, and people vote to re-up it, because when you're driving through town and you see those curb and gutter signs, you know, and all the things they're doing, and it tells you their PPRTA dollars at work, you go, oh, I like that. I think I'm going to keep doing that. So I think that might be something that we can think about, especially if we do decide to go ask the voters, is to think about a sunset. I know that creates some stress when you're, you know, thinking that this money won't come in permanently. It also creates some pressure to be creative and figure out other ways to do it. So I would like to get some more community input on this. I don't want to rule anything off the table right now. I'd like to get more feedback from the city administrator on what something like a marijuana tax would look like. I'd like to hear from the marijuana businesses in town about this. And which brings me to the ultimate closing point, which is if we're looking to do this by next spring, how does that fit into our schedule of not only just council meetings, but staff time and all of that? So, I mean, I don't have to have that answer tonight, but I think that would be a question that city administration could contemplate about this. Thank you.
Thank you, Counselor. Counselor Wolf, you'd spoken previously and expressed some ideas. Do you have anything you'd like to add at this point?
Yes, I'm in
Please.
favor of Plan 3, which is the simple plan for starters. I agree with everything that Nancy Fortune and Steve Bremner said. I have comments. I think the marijuana tax is a bad idea. My sense is that people already drive to Pueblo because the marijuana tax is so high in Manitou. So I agree with when Steve said you don't want to kill the egg that lays the golden egg, or whatever, the goose that lays the golden egg. I think I don't like that idea. In fact, I like what Nancy had suggested, is that we ask staff to go back to the drawing board and look at our current budget proposed for 2021 to see if we could possibly reallocate some dollars to help fund that. I like the idea of the person, like Steve Bremner mentioned, being assigned to basically identify where these camps are and to work with the property owners to get a financial assistance in cleaning them up, or financial assistance in paying the Colorado Springs Beautiful group. I like the chief's suggestion that we set aside $47,000 in the budget to be used exclusively to pay the Colorado Springs Beautiful, keep Colorado Springs Beautiful, I guess it is, to do their $600 a day cleanup, because I don't think the person that we should hire should do that. And I understand that there's been discussion in the past and hopefully some movement toward expanding Quick Fix so that we can actually allow people who identify these camps that are perhaps right outside our city limits to still pin them, because we've been talking about that for a while, and that's something that this employee could do. I think it's great that the chief is considering trying to get a grant for the $30,000 super drone. I think that'd be awesome. And then we could figure out how to find someone to get, how to get somebody licensed. I don't want to start off with the Cadillac plan at all, for all the reasons that's been stated already. I also think the person who is hired could easily partner indirectly if necessary, or the police could partner indirectly if necessary, because anytime they interface directly with the folks in the encampments, they can certainly hand out little business cards for the beehive and tell them you could just walk down there and here are their hours. But I also am hopeful that perhaps when the word gets out that Manitou has a zero tolerance policy for these unlawful encampments, that perhaps people will be less likely to choose these areas here. It's a lot of work to set up camp and a lot of, hauling all your stuff. So maybe we'll be lucky and we'll have a vast reduction in our homeless camps, even if we don't fund someone to try to also solve the mental health problems that we have. So I'm in favor of Plan 3. As so long as the definition of the employee or person being hired is, as I explained. I think it's great to think about looking for a place in the budget to fund this, like Nancy had suggested, or at least partial funding for this. But I don't think it's necessary to invade the general fund without first having the budget reevaluated, because some of the explanations about what some of the staff does, it's hard to understand when all I get to do is read about it in the city report every week about how, is it really that essential that we have an events coordinator both at the chamber and at the city? And maybe we could use some of those funds to help fund this new position. And then I'd also like to see that perhaps 9 months after the person is hired, that we hear a report back and we take a look at where we are and see if at that point, are things going great? Do we want to move to plan 2 at that point? Or because I'd like to reevaluate it. I'm not in favor of community input at this point. I think this is rather urgent, and I see no reason why we can't go forward with basically hiring someone. We didn't get community input before we hired Alex or all these other relatively new positions. I trust that hopefully our citizens will think we're doing the right thing because we're trying to combat the fires and these encampments. So if we look in 9 months and it's going great, perhaps then we could look at some of these wonderful other creative ideas of working with funding the Beehive or some position, in-house later. But I'd like to start with Plan 3.
Okay, great, thank you.
Thanks.
Thank you. Councilor Chandler, you'd spoken earlier, it's largely about the Beehive and its future. I was wondering if you had other comments you wanted to make relative to the chief's proposal.
Well, I want to say I thought there were a lot of really, really interesting ideas expressed here tonight, and I'm really pleased to hear that. I just want to remind everyone that about nationwide, about 64 or greater % of the people that are incarcerated are mentally ill. And there's a reason why they're not in mental health facilities. It's because they've been grossly defunded. And so people have trouble talking about and funding mental health. And I think it's easier for us to talk about how we're going to eradicate the homeless camps, and it's harder to talk about how we're going to deal with systemic problems that continue to keep these homeless camps coming back. I appreciated Steve Bremner's comment that Chief Brian put on the slide, that we can do both at the same time, and I'd like to see that happen. However, in my 26 years as a nurse and a nurse practitioner, I've seen mental health woefully defunded. So make no mistake, these homeless camps are not going to go away until we start looking at putting in some systems in place to help alleviate the burden of housing and food insecurity and so forth. I do really, I appreciate though that there's a lot of, seems to be a lot of interest in doing something moving forward. I'm certainly not opposed at looking at a sunset to any tax we do. I don't think that's unreasonable. I think that starting slow, what I'd like to propose is that the Beehive come back and we sit down with Chief Churchill and look at some of these proposals that are on the table and take a look at some of them and see if they're implementable. I will tell you that, again, I'm relying heavily on volunteer hours, and this kind of volunteer initiative isn't like serving on another committee. We have to rely on people who are very highly trained and highly skilled at mental health intervention. So I'm relying on an amazing community of people right now that have that skill set, but mental health also carries a high degree of burnout. And I will tell you that the Beehive cannot continue to rely on the number of hours of volunteer staff without having some kind of structure where we have some paid employees doing this very, very hard work. And also we're not doing it during necessarily normal business hours. We're trying to deal with things as the need arises, and sometimes that's not 8 to 5 Monday through Friday. So I realize I hear we're not ready for number 3, and we're not ready to it's hard to get communities to fund anything with mental health. So I'm not surprised at all. We're not ready, and we're somewhat skittish about the marijuana tax. But I would like to see something happening moving forward so we can tell our community that we do have a vested interest in it. I will, and Susan Wolbrook, Councilor Wolbrook, I just wanted to tell you too that we are part of the Beehive is initiating a community-wide survey. We are going to be asking things like, what would you like to see at the Beehive, or what would bring you to the Beehive, or what is lacking in Manitou Springs that are basic things that you need, that you've really done a good job of expressing. And we are going to compile that data. And we are also doing 3 to 4 phases of the Beehive. So just like Mayor Pro Tem Fortune mentioned, we are phasing in things. So the fall and winter, we're phasing in, getting the charitable entity set up, and getting volunteers, and getting Aspen Point and Tessa and restorative justice. And that was kind of phase 1. Phase 2 is the community survey and that data. And then phase 3 is going to be bringing on community practitioners. And we're going to have a tiered approach where practitioners can provide pro bono services. They can provide a combination of pro bono and paid services, and so on and so forth. And so that will kind of inform what kind of fees or whatever is associated with their using the facility, and the website and that kind of thing. So so I like the tiered approach too. So I just want to, I guess I just want to keep this conversation going. And I think the council has really given the Beehive and the chief of police and the administrator a lot of really good ideas to start chewing on. So I do really appreciate that. Thank you.
Great. Thank you. And Denise, you have a comment?
Yeah, can I just make a couple of comments? Because I know there have been some questions. So I'd like to take a moment to answer.
No, please go ahead. Yeah.
One, C-Click Fix, it was expanded. I sent an email out to all council. I believe that was yesterday. So that was expanded and it's been done, and you can click outside of the city limits. So, and Lynn Johnson gets the credit for making that happen. So I just want to mention that. Also, during the budget meeting, I did state 2 things. One is we're hoping the March-April time frame, we're going to be coming back to council to just give the option if you wanted to do our parking enterprise and what that would look like. That's our goal. Beck and I are starting to meet with the financial planners and see what that would entail. And then I said May or June, one of the concerns, as I believe as a city, is really sustainability. If marijuana becomes legal, or when it may become legal, we have to look at as a city of what does that look like. I believe we've got to build our reserves a little bit higher. They are not where they should be. We still have capital projects. We still have other things going on and other projects and initiatives that we've already got grants for that we have to fund, or we have to send it back. And some of them we've started partially. So we are looking at hopefully May, June, July timeframe. We are going to be bringing to you all different options. What does that look like to sustain this city long term? Are there other taxes? Are there other things that we can do? So we're going to be looking and gathering that information right now. We're starting to hopefully, I think it's next week is our first initial meeting. That takes time. You know, when you look at making decisions, there's lots of things that you have to do, right? You have to look at all the options, you have to analyze them, and you have to put weights on them. And then that's the decision-making model. And so we'll be walking through that when we look at the sustainability. I will say, from a staffing perspective, I know that the events coordinator has been mentioned several times. And I will say her workload, even though, yes, the chamber has an events coordinator that manages just the chamber events, we also have events that's city focused. And right now she is the COVID coordinator. She's helping Roy with TMMP, and we're giving her other special projects. So it's not that, oh, we have this coordinator and what they are. And I would ask all of you at any time to call me or to even sit down. I'll have you sit with anybody or myself or whatever and see what the workload looks like, to really understand what every position is doing and what are their responsibilities. So it's not as easy to say, what is this person doing or what is that? And maybe you can reallocate. If you say we need to reallocate, then I will look at that and say, how do we do it? And I'll bring that back to you. But this is a big concern in any capital project or any project that goes to $300,000 to $400,000 in the budget is substantial. And we have to look at that holistically. So those are things that we will be looking at in the June, July timeframe. And Councillor Chandler, as you ask the survey, I think one of the questions to ask is, are people willing to pay higher taxes? Are they willing to take on those things for these services? The other part that I will say, if we have a fire tomorrow, but we have a water break and we don't have a hydrant working, that's another issue, right? So it's all these things. It's not just a silver bullet. And I keep saying that there is not a silver bullet to any of this. It is very holistic, and we've got to look at it from a holistic perspective. If you take it here, what hurts here? And is that okay? Because that's the rationale model, right? That's the decision making. What's weighted? How do you make it? And what does it look like? And so the finance manager and myself, Becca, we're working on that. We'll be presenting a very holistic option and lots of options in the June, July, August timeframe. I think all of you know I'm very frugal. We did this last year with $800,000 less, and truly are providing you a better reserve than the city has had in a very long time. Staff and department heads will probably tell you that sometimes I frustrate them because I say, how can we do it? And do you have to justify it? And how can we do this? And is there an option here? And how can we save? This last year, if they wanted to buy a pencil, it was basically they had to ask permission because we needed to cut the budget to make it sustainable. So I just want to tell you, we are working on holistic model, and June, July, I'm hoping maybe we're going to be bringing all of those options of how do we do this long term.
Great, thank you, Denise. And Julie, just a minute. I was going to try and add a couple of comments here, but I'll come back to you. I've heard some really great ideas from everybody tonight, I think. And at the risk of sounding like a broken record, I'd like to commend the chief on the presentation that he did for us. I think the option one is an aspirational idea that maybe be the future of policing. I would probably tend to agree with Mayor Pro Tem Fortune that this would be something that the rest of the state would look to. Invariably, I always think about checkbooks and bank balances. So I probably lean more towards a pilot program, kind of an iterative approach, and not committing a huge amount of funds at the present time. I think maybe given the number of questions we have here, I think we could have a continuing discussion. And I think maybe we've got some questions that go back to staff, and then we could hear from this again, perhaps in the December timeframe. That said, I prefer not to. Okay, Denise, I would ask Denise what.
I don't think December is possible right now. We have November. I think that Chief needs some time to really vet this out. And I know that Councilor Brimner, you've done a phenomenal job with volunteers and really identifying them and going forward with that. But we've got the chief, if you're saying go with option 3, that kind of gives an option right now for him to vet and to start looking at. And then we can maybe in that April, March timeframe, or even during that June, July, look at this in more detail when we look at the whole holistic funding of how we're going to fund the city holistically if marijuana becomes legal in other areas.
Yeah. Well, I guess I've got 2 directions I'd like to go in, and they're sort of, at opposites. One is to, flesh this discussion out and come up with a good idea, something that we can, get our hands around. But I don't want to push this off too far and not do anything. It seems to me like sometimes we have discussions and meetings and so forth, and we never end up implementing anything. So I'd like to see something in the near term. If that's just option 3, which doesn't really, I think that's pretty revenue neutral. We could perhaps begin with that and start to do something. I see value in getting some community feedback. I don't know that I necessarily wait forever to make a decision on that. So I think if staff could begin to implement something to where we mitigate our fire danger, that's in my mind the most critical problem, and then move towards some of these other ideas. As we get into next year, that'd be my thought. So I would propose that we ask city staff to work on some of these questions, realizing that you already got a lot on your plate. So perhaps you could give it some thought and tell us when you might be able to get back to that. So that's my 2 cents. Councillor Wolf, you had a comment I think you wanted to follow on with or make?
Oh, I just wanted to mention, it's a bit of a side note, but in response to Denise's comments, which I really appreciate, a suggestion is, because I've gotten council correspondence complaining to me about why on earth are we funding an events coordinator, and the city report every week just says that she is reaching out to businesses to make sure they're happy about COVID measures. Perhaps explain in there for those few people who read it what she's doing, because that might be helpful. And then the other comment I wanted to make is that I'm not sure that our budget is necessarily higher than it's ever been in terms of our reserves. Rather, if we subtract the 1.4 million that we took out of URA, it's even more sketchy. So I agree that we have to be cautious about the spending. I'm not sure that this is a zero net endeavor if we go with Plan 1, because my notes show that the chief said that would be about 100 grand. I don't know if there's a way to make that less expensive, but perhaps we just need a little more detail on Plan 1. But it sounds like we're pretty much in consensus, with the exception of Judith Chandler, who wishes we could do more comprehensive plan right away. I think we're on the same page.
Oh, I don't know that I said that I was ready for a comprehensive plan. What I would like to see is a hybrid of option. I think I'm surprised that the council wants to go with any option, actually, given what most communities feel like with regards to anything regarding mental health. So I'm the kind of person that I'll take anything to start with, because if you're going to say it's this option or nothing, I'm the kind of person like, oh, I'm going to take that. But I certainly would like to start there. That's fine. I knew the council wasn't ready for option 3, but I do really appreciate Chief Brian's I appreciate the vision. I appreciate that I was really impressed that we tasked him with something and he came back with 10 times more than we even tasked him with. And that's impressive. But I would like to see perhaps a task force to put together a pilot that's maybe a hybrid for the next phase, because Mayor Pro Tem Fortune mentioned phases. I think that if we kind of start low, but say or start small, start where we need to start, which is fine. For all the reasons that were mentioned tonight, I would like to see a few of us sit in a room and flesh out a phase. If this is phase 1, a phase 2 kind of pilot program for maybe spring of next year. That'd be an idea I would have.
Good. Denise?
I just want to make, Councillor Wolf, thank you. I do want to say our reserves without the URA is 1.9 million, which is the highest it's been for some time. With the URA, it's 3.4 million money, which is one of the highest, if not the highest that it's ever been. But 1.9 is a lot higher than you have been for some time.
Oh, I appreciate that. And then part of that is URA money that was taken during Ken Jaray's administration.
That money is all for capital project. So it's not reserves, it's already capitalized. So this is the 1.9 is our reserves without the capital. So it's that, so yeah.
Thank you, that's great.
Yeah, you bet. And I also, the one thing I did forget to mention is, and all of you guys have said it, and it's 100%, Chief Churchill has done a tremendous amount of work on this. and has met with a lot of people and really looked at, you know, the whole thing and the vision that he has. And he's right, part of why he was hired is that community focus and really looking at it. So I did forget to mention that, and Chief, I apologize for that. Thank you.
Thank you. Councilor Wilbrook.
Thanks. This is just a side note and also a response to Councilor Wolf's questions. I mean, in particular about Alex's position, there's often not a lot of transition between one council to a next, but that was actually discussed with the community through the community engagement forums that Ken Duray and others put on. And it was determined by the end of 2019 that our city really did lack that basic communication that Alex is providing. And he's doing more than basic, but he certainly gets the word out when there's a water main break and all these other things. And that the previous council did task Denise with finding a way to make that happen. But it's just, I just know that you can't know that, because if you didn't come to every council meeting, and even if you did when you weren't on council, I don't know that you would remember it all. So there's just always some hiccups when we transition. And I just didn't want to let that go, because it did have it. That doesn't mean that I'm right about what I said tonight and we need it for this event, but it does occur to me that, again, my comment is, you know, a month ago, we were a lot more urgent about this, and the budget is always very sobering. So that's tempered us a little bit, but I still hold on to really wondering what the reaction of the 25 people who aren't on council and staff tonight on this call. Be very interested to know what they think about it, because they're still sitting there wondering if next year is the year that we get consumed by fire. So that's just, something to think about. Thanks.
Great, thank you. I think we beat this horse hard enough tonight. I think we have some ideas here that we can hand back to staff and ask for their thoughts, back at some future date. Does that sound reasonable, or if somebody's got a better idea? Okay, all right.
Can I just clarify something? Because
Please do so.
I was under the impression that option 3 was revenue neutral. But I heard now that it's $100,000 or $200,000, so I'm confused. You're hiring against the current manpower slots that you have. That's the cost, right?
The basic option 3 is already funded. There are already people that we're hiring. There's no additional dollars to it. It just takes our cushion officer off of the street and details them to this. What I did like, and what I'd really like to look into, is Councilor Brimner's idea of supplementing that officer that's already on the books, already getting hired, with possibly a contract civilian employee that works out to help up there on the Hill, and tying all the other resources and liaisons together. But yes, 3 by itself, revenue neutral.
Okay, so my sense is what I'm kind of hearing, and I want to clarify this, is that yes, council is giving guidance, I think, to go out and start implementing course of action 3. Am I incorrect in that? I mean, we don't need you guys to come back to start implementing that. I'm seeing a lot of shaking. So I think
that's what I've heard is, and that contract, we can go back and look at it and see if it's 20 hours, 10 hours, what that entails, because you really have to look at a job description and figure that out before you just move to that.
Right. Okay, thank you, that helps.
So we're currently in the hiring process for those 2 officers. I would imagine we're looking for a lateral that won't have to do a lot of time in field training. So I would imagine option 3, the officer would be available to start the program in February or March. Until that time frame, we have added money to the LEAP program. We're bringing in more officers off duty, and we'll continue with the LEAP program that we currently have on steroids until probably very early spring, late February, March sometime.
The other thing that, and I just want to mention this, the other thing that we can do, and that Chief and I talked about today, is really bringing the city and the county together. I'm going to pull together the county administrator and the city of Coral Springs administrator and talk about how we can make this a higher priority, because this is, and CSU, because this is their watershed over here, and they have a lot of property over here that we need to bring them and really get them on the same team with us.
Thank you. Okay, if there are no further comments on this topic, I would propose that we get on to council correspondence. Okay, looks like there's no objection to that. Chief Churchill, Chief Forsett, thank you very much for your good work. We appreciate it very much. Thank you.
Yes,
Okay.
thanks.
Great. Okay, council correspondence. Who'd like to start off? Well, I guess we don't have to say anything. I'm hoping to get together with County Commissioner Stan Vanderwerf and talk about mainly two things. And he just got elected, so he's been real busy, re-elected. One is traffic safety on Highway 24. There's a couple issues up there. And then the other thing would be really a follow-on to this homelessness and wildlands fire. I think we think of this as being a Manitou problem, but some of this is county land. I think they should be aware of the problem, and we should maybe look to seeing where we can get partnerships. So that's my 2 cents. Anybody else?
I don't have anything this evening. Thank you.
Okay. Thank you, Councilor Chandler. All right, there being no further comments, let's go on to the city administrator's report. Mr. Cheney?
Yeah, just a couple things. The water department's doing water testing or pressure testing in all the pipes and making some adjustments to try to help prevent any problems with pressure and bursting of the pipes. So they're making great progress with that. The Public Works building is going on, as you know, and is going as planned. Weather's been helpful. And Dole and Jeff Jones, Public Works Director, are working on that Ruxton blind corner, that Ruxton winter area, and try to come up with some solutions to protect pedestrians, et cetera. That's all I have. Thank you.
Roy, do you want to mention just briefly about the Hiawatha, anything there?
Sure. We met yesterday, and we had a second report from Cushing Terrell. They did a wonderful job in talking about the structure. And so the task force is meeting in 2 weeks, and we're bringing a couple extra people on board that had interest in joining the task force to discuss how to go forward. So I think that's all, unless Nancy, you want to add anything?
No, we'll be looking to get on council's agenda in the near future. In all likelihood, we'll bring a fairly significant proposal to council. Thanks. That would be time sensitive.
Denise?
No, just a couple quick things. Is Monday we do close City Hall and then it will be by appointments only. So we'll be posting that and getting it out. We will have phone numbers on the front door, so if they need to reach somebody, every department will make sure that they are available for phone calls or emails during the day, so that we can really manage that expectation. So that is happening starting Monday. I do want to say that the library task force, Christine is doing a great job leading that, managing it. They are starting to meet, I believe, weekly. So we're working on that, and I hope to have something back to you in the near future on that one. The municipal zoning code update project, the contractor has been, or the consultant has been selected. I don't know if I'm ready to announce that or if they're ready to announce it, but just wanted to let you know that that's happening. So January, we can start that project. That is a very heavy lift for that department. So we're excited to do that. Other than that, I'm, COVID-19, really working with the county and the school district, trying to manage through that as we do it. And I think that's really all. I'm trying to think, but that's about all I have at this point.
Denise, the blood drive, I think that's next Tuesday.
Next week, is that correct? So, and that will be a concern of how we're going to do it. We may have them entering in a different door from the community, those type of things. So we'll see when we get there. But is that next week, Susan? I'm sorry, I can't remember.
Oh, oops. It's November 10th.
Okay.
And Megan is, the coordinator with Vitalant. So I imagine if you come up with anything, you might want to let them know just to make sure it follows their protocols. Because I'm not familiar, but I know they have a lot of rules that I don't sometimes think of with that. Would love to see everyone sign up to do that if we can still do it. And I'm assuming we can. There's still a lot of great work happening with blood and plasma with COVID, and it really can save lives, especially for people who are very ill with COVID. Getting that blood transfusion or plasma transfusion with COVID antibodies can save their lives. So I'll be sending out my, bi-monthly email to beg you all to sign up. And I hope to see you there. And please let your friends and neighbors know too.
Great, thank
And
you.
if you have any ideas again with COVID-19 on our, please send them to us, because there's sometimes one idea leads to 5 other ideas that just end up being the right thing. So please send us any ideas that you have. I'm sorry, Judy.
Great, thank you, Judy.
I just got something today from the El Paso County Elections Clerk and Recorder, and I just wanted to share. We had our vote center here at Memorial Hall, and they mentioned that we had 275 people who went into the voting center to vote, and 84 people who dropped off their ballots inside the vote center. So just wanted to share that so you could see how that benefited our community.
Great, excellent, thank you. Well, I think we've covered everything we set out to do. So the last piece of work here is to adjourn. If there's no objections, let's call it a night. I see no objections. Good night. Thank you all. Take care.
All right, thank you.